Pericarditis is an inflammation of the pericardium, a double-layered fibroelastic sac surrounding the heart. It can be classified into several types, including acute, chronic, recurrent, and constrictive pericarditis. Acute pericarditis develops suddenly and typically lasts for less than 4 to 6 weeks, while chronic pericarditis persists for more than 3 months. Recurrent pericarditis occurs when pericarditis develops for a second time after a period of at least 4 weeks without symptoms. Constrictive pericarditis is a severe form where the inflamed layers of the pericardium stiffen, thicken, and stick together, interfering with the heart's normal function. The etiology of pericarditis is often unknown, but several factors can cause it. These include viral, bacterial, fungal, and parasitic infections, autoimmune diseases, trauma, and malignancy. In up to 90% of cases, the cause is unknown, leading to a diagnosis of idiopathic pericarditis. Diagnosis of acute pericarditis should include a history, physical examination, electrocardiography, chest radiography, and baseline laboratory studies such as complete blood count, basic metabolic panel, troponin 1 and creatine kinase levels, erythrocyte sedimentation rate, and serum C-reactive protein levels. Additional laboratory testing and imaging are dictated by clinical presentation and risk factors. Transthoracic echocardiography should be performed in all patients with suspected acute pericarditis to exclude pericardial effusion and cardiac tamponade. Electrocardiographic findings in acute pericarditis include widespread concave upward ST segment elevation without reciprocal T-wave inversions or Q waves. Chest pain is a common symptom, often sharp and stabbing, and may get worse when coughing, swallowing, taking deep breaths, or lying flat. The pain usually feels better when sitting up and leaning forward. Treatment for acute pericarditis typically includes medication for pain and inflammation. Non-steroidal anti-inflammatory drugs such as ibuprofen or high-dose aspirin are often used. Colchicine may be used as monotherapy or in combination with a non-steroidal anti-inflammatory drug for the first episode of acute pericarditis. If there is a fluid buildup in the pericardium, drainage may be necessary. For constrictive pericarditis, surgery may be required. In summary, pericarditis is a condition with various types and etiologies, and its diagnosis and treatment involve a combination of clinical evaluation, imaging, and laboratory tests, with treatment focusing on managing symptoms and addressing underlying causes. Thanks for watching.